In the event of a fire or emergency, there are fire exits to my right. So if you can make yourself not to the front, but to the back left canopy, close to the car park, that would be great. That shouldn't be an issue, but if there is. Second of all, if you have taken your seats, as my mother mentioned, without registering, please ensure that you do go back and register for fire, health and safety reasons. Speaking of the car park, for those of you who have driven here today, if you could ensure that you park appropriately in the designated areas without obstructing vehicles and paths, that would be great. If you cannot find space to park, please ensure that you park in the overflow car park out back. There are also bathrooms located to my front, so the ladies right here and the gents right here. Disabled toilets are included in the ladies' toilets. Now, upon your entry towards your back, you would have spotted a display of artwork from the exhibition which took place here last week. You are more than welcome to browse as you pass by, but I must emphasize that these pieces are not to be touched, and the barriers in front of them are also not to be crossed. You will be pleased to know that there is a stall to my left selling refreshments throughout the event for a reasonable price, so please feel free to stock up on your snacks. We will have a short break in between, so if you haven't grabbed any snacks now, you'll have a chance to later. If for any reasons you are to leave before the event finishes, please ensure that you do wait until the current speaker finishes. This way we can minimize any sort of interruptions for the speaker and for the audience. And finally, we'd like to say a huge thank you to our sponsor, JKNS Education, for the generous donation of folders that you have all been provided with today. JKNS Education is an online and face-to-face platform, an organisation that has been tutoring for the past 10 years. They tutor in various sciences and maths for those in Year 7 up until Year 13. And they're based in East London, but as I said, they do provide online tutoring support as well. Now, it is wonderful to see such a turnout for Young Lotus Caring Hands' first careers event. Young LCH has put a lot of effort into ensuring they provide support for their fellow young Thummels, and this support will be ongoing. The aim of this event and following events is to ensure that Thummels are provided with enough information from various career backgrounds and to provide an environment for young Thummels to network. We have individuals from various walks of life, as you will see shortly, so please don't hesitate to ask any questions or to interact. This is an opportunity for the youth to make necessary contacts in order to aid growth in industries that may tickle your fancy. We have various speakers, and even in certain career paths that may not be of interest to you at present, but their journeys may be interesting and beneficial for you to hear about. I would also like to say a huge thank you to Lotus Caring Hands for supporting Young LCH in organising this event and for dedicating a lot of time to ensure this event runs smoothly. I would like to say a huge thank you to our speakers and individuals at our booths for taking time out of their weeks to attend meetings, to ensure that the event runs successfully, and for taking time out of their day-to-day, travelling from all parts of the UK to provide insight for those curious about their roles, experience, and educational decisions. Young LCH has conducted various projects over the years. One of many is their online interaction with children in Hatton, Sri Lanka, teaching spoken English in order to build confidence and help with their careers. If any of you are willing to provide support or have any projects in mind that you would like to conduct, please come forward and speak with any one of us. It will be incredibly helpful for those who may be able to benefit from your transferable skills, And in addition, it looks great on your personal statement or your CVs, so I know it's for a charitable cause, but there is a mutual benefit involved. To register, you can use the QR code provided in your folders. Also, feel free to check out YLCH's YouTube channel to see our various endeavours and performances from our annual show Andimale with various artists from India and throughout Europe. Now, to move on to our first speaker. I would like to start by introducing Vidhya. Those of you who are attending from Dr. Challoner's High School may be inspired to know that this is where she started her journey too. Vidhya commenced her advanced education at Queen Mary, studying global health, continued her education at Imperial College London by taking up a master's in public health, and is now a PhD student in global and public health and policy. As if this alone is not impressive enough, she also teaches global and public health masters at Queen Mary University, London. Some of you may also recognize Vidhya due to her countless students she has tutored and supported. May I please call upon Vidhya Sasitharan to enlighten us further on her journey and her current position in her career.
Hello everyone, it's lovely to meet you all here today. As I was kindly introduced, my name is Vidhya Sasitharan and I'm a third year PhD student at Queen Mary University of London, and I also teach at the university on the Global and Public Health Masters. So thank you very much for the introduction. So I'll go on to talk a little bit about global and public health as a field, as often when I introduce myself, people often ask, okay, so what is it? What is actually global and public health? So just a little overview on the subject itself. Global health is a transdisciplinary field. It aims to improve the health and well-being of individuals across the world and address health inequalities. It's based on the knowledge that good health is fundamental for a high quality of life, and I think the pandemic was testimony to that. As soon as our health was jeopardized, the whole world came to a standstill. So global and public health tries to tackle the various challenges and global health challenges that we see today, whether it be the rise in non-communicable diseases, whether it be cancer, respiratory diseases, infectious disease, which we will only see a rise of as a result of various environmental challenges as well. And as we saw with the COVID pandemic, how important it is for us to be prepared for this, as well as thinking about how we can strengthen and improve our healthcare systems to adapt to an ever-growing population and an aging population too. So this is just a taster of the various different themes that global health tackles, and it works with a variety of different sectors and disciplines, whether it be economics, medicine, policy, law, geography, just to name a few. So I began my global health career as still a student, but still also doing a career at the same time simultaneously, and I almost stumbled across the field itself. And it was through a actual careers event similar to this that I came across the field, and I decided to choose my undergraduate degree in global health, and I continued to pursue that. So when I was studying my undergraduate degree, I was fortunate enough to have various opportunities to do a number of different internships and placements with a variety of organizations, both local, national, and international. And one of these organizations was called Pesticide Action Network UK, which is an NGO group. And with this organization, I created a tool to tackle pesticide poisoning, which impacts farmers predominantly as a result of their occupational exposure. And this tool was then used to identify the various different signs and symptoms that they experience, whether it be headaches, neurological complications, or genetic complications in subsequent populations. And as I was doing this internship, I realized that this was actually a field that I was very much interested in and wanted to pursue. And it happened to be by chance that when I was doing my undergraduate degree in my third year, that one of my lecturers proposed this opportunity of applying for a studentship for a fully funded master's and a PhD. And for this, I would have to write a research proposal indicating what research subject I'd like to. And following my internship, I thought, okay, let's think about pesticide poisoning, as it's an area that has been largely neglected, but as an area where large impact can be made, as pesticide poisoning is something that's completely preventable. So then, following this, I completed a research proposal and submitted it to my funders, who were Liz DTP, and I was successful in my application. And I think the factor that made my application successful was all this internships, work placements, and experiences that I had conducted during my undergraduate degree. So I'll definitely encourage you all to maximize those summers that you have in university and also at school, to think about how you can find various different opportunities to start getting a taster of different fields you might potentially like to explore. Because no experience is bad experience. It all gives you an idea of what you like and helps you find your niche and where you might like to progress your career path into. So then going back to my career, so once I was successful with the application, I finished my master's and now I'm pursuing my PhD. So often when I say I'm doing a PhD, people often wonder, what do I actually do on a day-to-day basis? So a PhD is a very large research project lasting 3 to 4 years. It's completely independent, so the design of the whole project is entirely yours, which is exciting, but at the same time can be quite overwhelming. From beginning to end, it's on your terms. So it means you have to have that self-discipline, that self-drive. Each and every day, you decide what tasks need to be completed, the deadlines that you need to meet in order to fulfill your project. So my project looks at the role of social determinants of health in unintentional pesticide poisoning and the barriers to adopting agroecological alternatives. Essentially, what I'm looking at is seeing who is most vulnerable amongst the farming group of experiencing pesticide poisoning, and how and whether they are being sufficiently protected, and if not, what can be done to protect them in the future. So the PhD not only enables you to develop an in-depth knowledge of your specialist subject, but it allows you to develop and hone a wide range of research skills, whether it be quantitative or qualitative, depending on your project. Data analysis skills, project management skills is the biggest project that you are deciding and creating on your own. Time management skills, and a variety of interpersonal skills as you interact with a wide range of academics to make sure you realize how your new science is adding to the current field. And at the end of the day, the end result is a publication-worthy thesis. So this is what a PhD itself entails, but at the same time, a PhD brings in various different opportunities. For example, teaching, as I currently am. So I'm teaching on the Global and Public Health Masters and have been doing so for the last 2 years. So this entails creating the syllabus, creating the module content, creating assignments, marking assignments, and completing feedback for the students too. So it's very interactive and it's a very rewarding experience. And as I've done it, I've realized that teaching is something I'd perhaps like to pursue at a later stage in my academic career. So then I'm also now fulfilling a certificate in teaching and learning, so to help with an academic career in teaching at higher level institutions at a later stage. This is another thing. When different opportunities in training, completing trainings come about, I'll definitely recommend you to utilize them, because even if it might be, I'm not sure if I want to go down this route, there's no harm in expanding your skill set, trying new things, because you never know how they might come in handy at a later stage. Even if it's not something you want to do immediately, maybe a few years down the line, it could be something that you might want to do itself. So just another food for thought too. So I'm almost at the end of my PhD now, and in regards to next steps, I'm actually thinking to move away from the academic career slightly, but to go into the NGO sector to think about and work with NGOs on health and healthcare project management. And the good thing about a PhD and a field in global health is many of these skills are transferable. Many of the skills in critical thinking, interpersonal skills, can be transferred, and because of the breadth of the field, they can be almost seamlessly interchangeable and seamlessly used in various careers. And an academic career is just one example of the many careers that you can go into in global health. There's various other opportunities. So for example, you can go into health advocacy, health consultancy at local levels for local councils, international level for large organizations such as the WHO, FAO, for example. You can go into research and development with pharmaceutical industries as one example. Another could be healthcare management, so working within the NHS too. There's various different training programs and graduate programs where you can then go on to work in the NHS at managerial levels. So the breadth of options within global and public health is vast, and there's many people from other careers who've moved into this sector at a later stage in their career, because I think now we're realizing the importance of preventive care and the importance of global and public health, especially after the pandemic. It really has become a thriving sector, and there's various different job opportunities, both nationally and also internationally too. But it's one that's often not thought about. Medicine, everyone knows and hears about, but these allied health sciences, not many people know. But there's various different options out there, and it's very much those from medicine have then also done an intercalated degree at one part of their studies, or have later decided to come to global health. But what I would say is definitely explore your options. Think about the wider options out there, not only the immediate subjects that come to mind, and explore them and see if there is a niche for you, because there probably will be something that you hadn't even thought about and you may come across at one point. So yes, that's just a little overview, and I'll be happy to take any questions, and you can find me in the booth later on too. Thank you very much. Does anyone have any questions at this point?
Sure.
So, in your research for PhD, what kinds of individuals have you met, and how did you actually get into this?
So my research has been very interesting, because initially the proposal that I had was to do it in Tanzania. I was going to go there for 6 months, do my research there, work with farmers and members of the farming community. Then the pandemic happened, which meant it was no longer feasible. So then I had to alter my project to a desk-based study. So I've been doing a global study, so using data that already exists, but also using a policy analysis, a logistic statistical regressions to kind of identify who's most vulnerable. But in terms of individuals I've met, it's more people from not doing interviews and focus groups or such in my research itself, but it's fellow academics via attending conferences and things like that. But there's a variety of people that you can see. So that's another tip. Network as much as you possibly can. So today is a great place to start that as well. Thank you very much.